Welcome back to the Morning Blend. There's no doubt chronic pain and inflammation worsens your quality of life.
That's right. We certainly have heard the dangers of opioids. So today, a more natural opioid, or option, sorry, it's non-opioid. So it's an option to help patients live a happier life. And I love when this guy visits our show. It's Omar Iliwa, and he is the pharmacist and owner of Welltopia. And he's here today to chat about Cytoquel. So we're going to learn all about it. Good to see you.
Good to see you.
I love it when you're here because I feel like you've changed my life with all the wonderful things that you bring into it. So yeah, this one, I do think a lot of people suffer a lot from chronic pain, inflammation. They don't find a lot of results from other options other than an opioid. So this is an opioid alternative that you're finding true results through research.
We talked 3 times before about chronic pain because this is kind of when you have chronic pain, you're cornered. You don't know what to do. And we're trying to always find a safer alternative that's herbal product. What I like about Cytoquel, it's kind of, we talked before about curcumin and how it helps with inflammation and pain. This is 5 ingredients. Curcumin is one of them, and they are all geared towards decreasing inflammation because chronic pain is like pain that lasts more than 3 months.
Yeah, a lot of people have that.
Okay, and this happens when there is like inflammatory markers called cytokines that come from the immune system, and they keep firing. Okay, when you control these inflammatory markers, this is how you can get less pain in your life. This product, the good thing about it is that there was a study about this specific product, and the study showed after 8 weeks of taking Cytoquel, 3 capsules a day, there was decrease in pain, 65%.
That's huge.
That's amazing. And what kinds of conditions do you feel it's helpful with?
So chronic pain that comes from any reason, like autoimmune conditions, rheumatoid arthritis, can come from migraine, can come from fibromyalgia. If you have chronic pain more than 3 months, that was what this product was studied for. It's a clinical product, like there has to be a consultation with it. That's why I encourage people to ask me questions after the show. I'm going to be like on my computer and with the phone just answering questions. So yeah, general pain that lasts 3 months or more. We are one of 23 million Americans who suffer from that. More than 10% of people have chronic pain conditions. This is a safer alternative. We don't want people to have misused NSAIDs and opioids and having problems with GI bleeding. And then if they don't want to take non-steroidal anti-inflammatory drugs, they take acetaminophen, Tylenol, high doses, mess up the liver. So we're trying to find something that actually improve the quality of life.
So are there any side effects to this? Because you said it's 5 ingredients and you said it's herbal. So are there side effects known?
So I looked at all of the interactions with drugs. If you're taking drugs, I have to look at what you take to counsel you. And we also want to make sure that your healthcare provider knows what you take. But this is curcumin, this is resveratrol. This is a form of vitamin E that's 40 and 60 times more effective than the vitamin E that's used in most of the vitamin E products taken for antioxidant and skin protection. Actually, vitamin E helps to control pain and inflammation. Okay.
My mom takes vitamin E, just the pure topfuracol, however you say it, you know? There
are 2, so every one of those products is like vitamin E, for instance, is like something called tocopherol or tocotrienol. Tocotrienol is the one that helps with inflammation. So it's it's very specific.
Well, and a lot of people, I mean, you mentioned acetaminophen, Advil, Tylenol, ibuprofen, those are forms of it, Aleve, the opioids. I mean, some people take these types of drugs daily and for years.
That's a problem. And then we mess up the kidneys, we mess up the liver, we mess up the gastrointestinal health. We have GI bleeding. So, I mean, like, it's an expensive product. This costs $64, okay?
And how much of a treatment is that? Would it last a month? For
a month, okay? But then you have to have another option. You have to find another way to control the pain. I have really good, we have been using this product for 8 months, but people really rave about it. And but as I told you, it's a professional product. We need to make sure that your doctor knows what you take.
And the offer is only good for 1 week. So here's what you got to do. You have to order online. You can get 20% off Cytoquel. You do need to talk to Omar first so you can learn a little bit more about what you're taking. If anything interacts, he can talk to you about it. 262-429-9429, or online you can chat with him as well at welltopiarx.com. There's an Ask Omar button too. Thanks so much for being here.
Thank you.
Love it, Omar.
Cool stuff.